Radyo Agila. DCEC 1062 sa Mega Manila, WIN 1080 sa Northern Luzon, DZEL 1260 sa Southern Taga, UYFX 1305 sa Visayas, at DXED 1224 sa Southern Mindanao. Ito ang Radyo Agila. Mabilis, malakas, pumapagaspas.
Ang paglalakad ay isang simpleng uri ng exercise. Pwedeng gawin patungo man sa trabaho, school, palengke, pag-akyat o pagbaba sa hagdan. Alam niyo ba na ang 15 to 30 minutes ng brisk walking o mabilis na paglakad araw-araw ay may malaking positibong epekto sa ating overall health? Ang mga benepisyo sa paglalakad ay ang mga sumusunod. Una, pang-iwas sa sakit sa puso. Pangalawa, malaking tulong sa digestion. Pangatlo, pinapatibay ang ating baga. Pang-apat, pinatitibay ang ating bones and joints. Panlima, panluna sa back pain. Pang-anim, hinuhubog ang mga kalamnan. At pampito, pinapakalma ang isipan. At ngayong alam nyo na ang benepisyong dulot ng paglalakad, ano pang iniintay nyo? Simulan na nating maglakad. Nakatitipid ka na, mabuti pa sa kalusugan. Isang pangkalusugang paalaala ng Radyo Agila.
Handa ka na ba sa parating na bagyo, baha, lindol at iba pang uri ng sakuna? Huwag magpahuli. Alamin ang mangyayari. Maging alisto, maging alerto. Eagle Network. Subaybayan tuwing alas 10 hanggang alas 12, gabi-gabi. Kasama ang buong pwersa ng Radyo Agila Reporter, ang tunay na serbisyo publiko. Walang pahinga, walang pagod. Magbabantay, maglilingkod. Eagle Network.
Serbisyong pangkabuhayan, napapanahong talakayan ukol sa dagdag kita para sa pangkabuhayan. Ihatid sa atin ng tambalang Mona Dagsaan at tuwing maduma, tuwing Biyernes, alas 3 hanggang alas 4 ng hapon. Dito lang sa Net 25, Radyo Agila. Serbisyong pangkabuhayan, napapanahong talakayan ukol sa dagdag kita para sa pangkabuhayan. Ihatid sa atin ng tambalang Mona Dagsaan at tuwing maduma, tuwing Biyernes, alas 3 hanggang alas 4 ng hapon. Dito lang sa Net 25, Radyo Agila.
Ang oras na ito ay hatid sa inyo ng Cable Link, your link to a world-class entertainment.
Mga bagong kaalaman sa siyensiya at teknolohiya. Alamin sa programang Pinoy Scientist. Tuwing Linggo, alas 5 ng hapon hanggang alas 6 ng gabi. Pinoy Scientist. KBP Best Science and Technology Radio Program. Pinoy Scientist. Dito sa Radyo Agila.
Magandang hapon po mga kabarangay. Ako po si Dr. Coster Diacaris, ang inyong kabarangay Pinoy Scientist, at welcome na naman po sa ikalawang episode ng Lakbay Kinabukasan, ang kauna-unahang programa sa radyo dito po sa Pilipinas na dedikado po sa futures thinking. Sa ating special po na segment ay pag-usapan natin ang emerging trends na maghuhubog sa ating kinabukasan, at kasama ko po ang ating co-host na nasa screen na po ngayon, si Professor Sherman Ortega, UNESCO Chair on Anticipatory Governance and Regenerative Studies. Magandang hapon, Professor Sherman.
Magandang hapon, Castor, at sa tagapakinig ng Pinoy Scientist. Magandang hapon po sa ating lahat.
Ayan, sa ating ikalawang episode, tatalakay natin ang pamagat po nito ay The Rise of Intelligent Healthcare and Human Lifespan. Isa po itong napapanumpaksa dahil sa mabilis na pag-usbong po ng teknolohiya sa larangan po ng medisina at healthcare. Andiyan pag-uusapan natin ang tungkol sa artificial intelligence, diagnostics using AI, hanggang sa mga probably futuristic na ospital na may mga robot nurse. Alam ko may isang ospital, Professor Sherman, I wouldn't mention that hospital, but they ordered a robot nurse, couple of robot nurse mula sa isang kaibigan ko na isang startup founder. So we will be expecting a hospital with robot nurses in maybe in the near future kasi nag-invest na po ngayon ang ibang mga ospital sa mga ganyang teknolohiya. Ayun po, ang ating katanungan. Posible po bang umabot, given all these technological breakthroughs, aabot po ba ng, let's say, 150 to 200 years ang buhay ng isang tao? At paano natin masisiguro na ang mga development at progress na yan ay maibibigay sa lahat? Hindi lang po sa mga mayayaman at sa mga politiko na may kakayahan na may access sa ating mga teknolohiya na yan. At para bigyan po tayo ng linaw sa ganyang topic ay andito po ang ating eksperto, kaibigan po ito ni Professor Sherman, si Dr. Paul Epping, isa po siyang global futurist, healthcare innovator at kasalukuyang leader ng Exponential EQ. Welcome to Pinoy Scientist, Dr. Paul Epping.
Good morning, good afternoon. I'm very honored to be here and share some insights about the future of healthcare.
Professor Sherman, is there? I know Dr. Paul is your friend. Can you give a brief background and the impact of the discussion that we'll be having this afternoon?
Yes. I've known Paul for several years now, and I've had the opportunity to work with him, as chair, for the Millennium Project. And we've had, discussions about the State of the Future Index, and one of the critical and crucial element of the State of the Future Index is definitely healthcare. And Paul is one of the foremost experts on this. So we will be hearing from Paul, at least in this conversation, about very many things, from how much can we actually live longer, what technologies and forces of change, can enable that, and we will be hearing more from Paul about this.
Yes,
Thank you.
Professor Sherman, we discussed the Millennium Project last week. So can you
Yes.
give us a little bit of a backgrounder for those who have just tuned in to Lakbay Kalikasan?
Yes, ang Millennium Project po, the Millennium Project po ay isa siyang network ng mga eksperto, scientists, futurists, economists, social scientists at marami pang iba, na tumutulong. Isa siyang think tank para pag-aralan kung ano ang estado ng kinabukasan sa iba't ibang domain, particularly, for example, sa population, nuclear energy, sustainable development, peace, at marami pang iba. Ang aming pong tanggapan or organization na nakabase po sa United States, sa Washington, yun po ang aming headquarters, pero may iba't ibang nodes po ang Millennium Project sa iba't ibang parte ng mundo. At si Paul po ay isa sa mga chair, at isa din po ako sa mga chairs ng the Millennium Project.
Oh, that's nice. At bago tayo muna mag-break kasi sisimulan natin ang ating talakayan, shoutout muna sa aking mga kaibigan. Nakikinig po ngayon si Dr. Alfred Alcantara. Siya po ay isang siyentipiko mula sa South Korea who will be joining us hopefully this year. And we'll be starting our microgravity experiments at my institute. And I'd like to greet my friends. Nag-aaral ako ngayon, nag-enroll ako Sherman ngayon ng Master's in Business Administration. So may mga classmates ako na nakikinig ngayon sa Human Resource Development Strategy and Analytics. Hello mga kaklase ko at ang aking professor na si Dr. AJ Orencio. Magandang hapon po sa inyong lahat. So ngayon po, mapapakinggan natin ang pagdidisenyo ng sistemang pangkalusugan ng healthcare na kadalasan napapanood po natin po sa pelikula. Ngayon po ay ito na po ay isang realidad na unti-unti pong nabubuo sa ibang parte ng mundo at pati na rin po sa Pilipinas. So mga kabarangay, maganda-handa po tayo sa makabudang talakayan. Dito po kung saan natin lalakbayin ang kinabukasan. Magbabalik po ang Pinoy Scientist.
EBC, Eagle Broadcasting Corporation. Ito ang Radyo Agila.
This lecture is brought to you by BioQuick, high-quality products for hospitals and labs with 19 years of dedicated service to the community. They have become your trusted partner for all things medical.
DCEC Radyo Agila. Lalong pinasigla, lalong pinalakas. Pumapagaspas!
Nagbabalik po ang Pinoy Scientist. Dito lang po tayo sa lakbay, kinabukasan. At Professor Sherman, pag-usapan na muna natin ngayon sa pangalawang segment, ang mga, let's say, what we call as exponential technologies that will be transforming healthcare and affecting longevity. So perhaps, Professor Sherman, maybe you can ask the first question to Professor Epping.
Yes, of course. Maraming salamat, Castor. No? Before anything else, Paul, I would like to ask you, some fundamental questions in order for us to put some premise on our conversation about, healthcare. Is, what exactly is intelligent healthcare? How is it different from conventional healthcare systems?
To be very bold, we are still in the age of healthcare seen as sick care. So if there is something wrong with our body or our mind, whatever, then healthcare is taking action, but always a little bit too late. That's not really smart. That's not intelligent at all. So what we are trying to do in, let's say, intelligent healthcare is to prevent people from diseases. And to make a very bold statement, let's say in 10 years from now, diseases will be optional. And we are moving towards that. It's not science fiction. We are moving towards that. And today, hopefully, I will be able to pave a kind of a road how to get there. And what is already peeking around corners that most people don't see, but that are already there, and how will that influence healthcare and contributing to that statement that diseases probably will be optional very soon.
So sorry, Paul, but so if diseases are optional, so maybe we can unsubscribe to flu or whatever in the future. What's your thought about having a more intelligent healthcare compared to a not so smart healthcare that we are having now?
Okay, good question. Thank you for that. So let's just lay some foundations here. So a basic, the basis, so that we know what we are talking about. Firstly, if we want to be in that little future, not far from now, healthcare has to be digitized. The fundamental thing is that we need data. And as we speak, even in a very modern country as the Netherlands, where I'm from, healthcare is still pretty much, the data in healthcare is pretty much fragmented. It means in many places and not always connected. So that's the first thing. Healthcare has to be digitized, full stop. And how can that be done? That can be done by implementing electronic healthcare systems, electronic healthcare records. There are many vendors out there who do have solutions that can be implemented. On top of that, and that is what I'm really an advocate for, is personal health records that are connected to those electronic health records. Because not everybody is ill all the time. And when you are ill, you are going to a hospital, then the electronic health record system is the place where you are collecting the data about your illness. But I am not a patient. I'm healthy, and I would love to have a full-blown personal health record where I can collect data about my health, and that I can run algorithms to predict what can be go wrong if I continue to do what I'm doing, and comes up with advices what to change to maintain my health in a good way. Then including in the digitization of health is also the data of labs or radiology, of our wearables. All those things have to be collected. And as I said before, it's not only when you are a patient, it has to be done continuously. And the big accelerators of change in healthcare, and I only mentioned the big ones, is obviously AI, artificial intelligence, nanotechnology, and biotechnology. And that includes synthetic biology. And talking about that, synthetic biology is able to not only read life, but also write life. That's kind of creepy, but that's where science is at the moment. But we have, of course, a big caveat here, which is safety. And safety is a multifaceted monster. There are so many aspects on safety. For instance, if you are talking about AI, we do not really know what's going on under the hood of AI. So we don't know to what extent it's safe and to what extent it's not. Where is it crossing certain lines that we don't know actually what will be a certain consequence. So what I would like to do is to walk with you through a very common approach in the medical world, which is starting with the diagnosis, then treatment, recovery or rehabilitation, and then talking about prevention. What are things that you can prevent? Telemedicine, probably, longevity, and specifically for nursing, I would also address death. I was in the opportunity to work with Aboitis in the Philippines, to work with people in Aboitis, to come up with ideas how can we change healthcare in the Philippines. But I also worked for a long time in the Middle East, and I met a lot of very, very high qualified Philippine nurses. And I dare to state that, for instance, in Saudi Arabia, that healthcare in Saudi Arabia runs on Philippine nurses. They are all over the place, and they are organizing the I would say high quality healthcare for patients. So in short, to summarize it, Custer and Sherman, an audience, we have to move from sick care to healthcare. That's the adagium.
It's good that you put on some sort of, a framework so what you just mentioned and how we're gonna approach this conversation. And it's nice that you mentioned one potential future when it comes to the future of healthcare is fundamental to its development is the digitization of it, right? And as you've mentioned, it is basically data driven from diagnosis to recovery or death, right? And with the use of artificial intelligence, it gives us an opportunity to actually expand its capacity or ways of functioning it at this different levels. And then you mentioned about Filipinos, right? Like Filipino nursing care. Now, I would just like to ask this question: like in a future wherein the healthcare system is fully digitized, and you have artificial intelligence and other forms of frontier technologies being used, where does care come in a future wherein everything is digitized?
Yeah. Specifically, the care. I think personally, I think that the future of healthcare will run on nurses, because they still are the profession that has the human touch for the patient. In the medical area, in many countries, and I presume also in the Philippines, is just a very, very short contact with a physician for a diagnosis, for a treatment. The physician shows up, an internist, internal medicine shows up on your bed and tells you, well, we have found this or that, and you have to take this or that medication, and up to the next one. There is hardly any interaction, and a longer interaction. That human touch is ripped out because of economic reasons. An example here is that it's stated in insurance policies that a physician cannot, can of course, but should do a diagnosis, an appointment that you have within 6 minutes or within 5 minutes, because that is where you get paid for. And if you exceed that, you are not getting paid for. So what the effect of that is that you are squeezing very important life, I would say sometimes life-threatening things in a very small amount of time because of economic reasons. And that is how we organized healthcare today, as healthcare is a business, where business rules are guiding. Nurses are breaking through that. Fortunately, they are, because they are not on that scheme of payment, they are taking care of the patients 8 hours a day, sometimes longer, to help them to understand their disease and to make their disease livable, not and taking the suffering from them. And I don't know if you guys have been patient yourself, but I have been that once in my life, pretty severe ill, and the anchors in my recovery, in the treatment, were the nurses. And the doctors, as I said before, hardly have any time. So the future, and it is very paradoxically, the work that physicians are doing are very factual. And the things that are factual will, per definition, be taken over by AI. AI today is already way better in getting to a right diagnosis than a physician. There are many studies done in that in that area, in that domain, and it is only the beginning. We are not even at a state that that algorithms have access to all the data. So imagine that will happen, that we get sooner and better diagnosis, more precise, where then in the next step, using AI again, can be defined the right treatment. What we also call more personalized healthcare, personalized medication. And not, okay, let's give that patient medication A, B, or C, from which we know that it is only effective in, for instance, 20 or 30% of the population. So now if we are making the move with the help of AI to make that more precise, then a patient can get the right medication at the right moment in the right dose. Not an overdose, not an underdose, the right dose. That's where we are moving to. And that can only be done when we are collecting data. And when we, you and I, allow hospitals to collect the data under one condition, that I am, as a patient, determine who has access to my data. The hospital can collect the data, but in the end, it's my data. So I need, as a patient, to be able to give other people access to my data, to grant them access. And as a patient here, or imagine that I would be a patient, I would grant access to people who are involved in my treatment. Because I know in the healthcare system where we are in, that the physicians will keep their promise and not share the data without telling me, without notifying. And that's not a utopia, that's what already is working, because I can see in my data who accessed my data.
I checked your LinkedIn, Paul. One of your friends is Dr. Suresh Ratan. He's a co-author in a paper, editor-in-chief of biogerontology. We worked in the past on aging, lifespan extension research. In any case, I was wondering, to have to place that the data collection and analysis of data as a reality. How do you see data governance would look like? Data governance, would there be a startup company, or is it in the realm of government to manage the data? And how can we ensure that those data will not be used against the people? Because you see, even the insurance company would love to grapple those data and charge higher premiums for those who might have predisposition to certain diseases.
Yeah. It's a very good question, and a tricky one. And I'm not always, but I'm pretty aware of the downside of collecting all that data, because if AI is getting smarter and smarter, and I'm also talking now about, imagine 10 years from now, that quantum computing will be up and running. Well, how secure will be our data? And are those systems, imagine that also in that world with quantum computing, we have artificial intelligence running all over the place, that we don't not really know who is doing what with my data. Not that will happen automatically, but I'm fearing that a lot of people will be, or not people, a lot of algorithms will be that smart that they find somehow access to my data. And that can be connected to my insurance policies or whatever. That is possible. And since we are aging, we are more prone to develop diseases. And in specifically that category of people, that can be a problem. I cannot really, Dr. Kuster, I cannot really say that we will be safe. That would be a too bold, too optimistic statement and scenario. I think that because what is going on in AI, there is I would say, a rat race, and there is a symmetric escalation of the development of AI. If this one is a little bit ahead of us, then the next one wants to be ahead, and that is going on and on and on and on, and it goes fast. But the dynamics are always the same, and in that race, what is not unimaginable is that shortcuts are going to be made to stay ahead. And once you bring that, for instance, in healthcare, it could be disastrous. You could overlook certain things, that in the end
I could hear you, Paul.
can harm.
I'm not sure if is it from my end?
Can you hear me, Sherman?
Sherman, I think Paul is good.
Okay,
Yeah.
I can hear Paul now.
Yeah. Okay, let me know if something is not going well. So there is so much to talk about in this case, Dr. Custer, that it's very hard to predict whether that will happen or not. But what I'm pretty sure about is that healthcare data is value for a lot of people, including insurance companies. Therefore, is that I think that we should, in our personal life, take accountability about your own health. There is now so much available that can help us to maintain our health on a high level. And there are only three things that are key here. Firstly, very, very much undervalued is sleep. Good night sleep is the best medicine. And I'm talking about good night sleep, which is about between 7 and 8 hours a night. Undisturbed sleep. Second is activities. Do your daily activities, exercises, every day. And do that for half an hour. And provenly, that has an effect on your health. People who are doing that have a survival chance of over 60%, provenly. Only half an hour a day. Do you walk, do you whatever exercises. You don't need to go out. You can do your exercises in your home, wherever you are. Push-ups, squats, you name it. And thirdly, healthy food, which means diverse, less meat, not processed food, and decrease your sugar intake. Those are very simple things that everybody can do today, but you have to discipline yourself to do that. I'm going every day for a walk, at least a half an hour to an hour, and at least 4 times in a week to a fitness center, where I spend 2 hours of my time to work myself into sweat and whatever. And that is helping. And I feel that. And specifically, when people are aging in the audience here, one of the most important things is your muscle mass. Your muscle mass is key. And if you don't do that because you think, well, I'm too old. No, you are not too old. You can get off the chair and off the couch and walk around to start with. You can do squats, you can do push-ups, and if you start with 2 or 3 that you cannot do 5, then 3 and 4 are fine, and those are the stepping stones to 10. But you have to discipline yourself. And staying in and maintaining good health is damn hard work. It's not, okay, I'm breathing now and breathing in the fresh air and now I'm healthy. It's not working like that. So those are a couple of simple things. And in the prevention, technology is helping us big time. For instance, with liquid biopsies. Liquid biopsies is a very small amount of blood that we can now see, for instance, certain cells, cancer cells floating around that are not active yet, but maybe can be getting active in 5-10 years from now. So you now already can do stuff to kill those cells. Or another thing is that is gaining a lot of more attention and popularity is investigating of our microbiome. So a little sample of your stool can be analyzed on bacteria that are in there. Our body is for about 60-70% bacteria. And they all have playing their role. And in science, people are getting better and a better understanding about the role of these bacteria and how and if they are changing, what is the cause for that? We find more and more of that information. And lastly, there is way more, but lastly, that is an interesting development, and that relates immediately to the collection of data, is the development of digital twins. So you can make a digital copy of yourself based on the data that is collected, that has been collected about your health. So your health data, and the more diverse health data you have, the better you can develop a digital twin that you can use to run experiments on. Like, what kind of medication works for Paul if he has this kind of a problem? So that can be done. There are some, let's say, challenges here, because you have to keep your digital twin up to date. But how are you doing that? But it is an important development that gains a lot of popularity, for instance, in clinical trials. So in that area, we can decrease the time of developing new medications dramatically. Just a couple of examples in this.
So we've already mentioned about synthetic biology. Also mentioned about liquid biopsy. Although I remember Theranos, it's a startup company in the U.S. that was a subject of fraud case, and they got a lot of money out of it. And then microbiome is really a very hot topic now. The gut microbiome and digital twins. So we got a good glimpse of technologies and pathways towards longevity. And maybe later we'll pause for a break, and maybe we can talk about possible business and because you are an entrepreneur, right? A serial entrepreneur. Maybe we can talk a little about opportunities in the field of business and entrepreneurship. And we'll pause for a few reminders. We'll be back after a while. So stay tuned, and we'll be answering the entrepreneurial opportunities for all this healthcare future, for an intelligent healthcare future. We'll be back.
EBC, Eagle Broadcasting Corporation. Ito ang Radyo Agila.
Pag may barya, mag-Savor Snack and Match na sa McDo. Ching, ching, snack a ching. Ching, ching, snack a ching sa McDo. 59 lang may snack ka na. At 25 mamag-float ka pa. Ching, ching, snack a ching. Enjoy McShaker fries, crispy chicken sandwich, and cheesy burger McDo for just 59 pesos each. Ching, ching, snack a ching sa McDo. McSavor Snack and Match. Enjoy it only at McDonald's. Available from January 20 to April 30, 2025 only. Per DTI Fair Trade Permit number FTEB 2115559 series of 2025.
This news is brought to you by BioQuick, high-quality products for hospitals and labs with 19 years of dedicated service to the community. They have become your trusted partner for all things medical.
Checkpoint 1062 sa presinto may takas. Pero sa checkpoint, walang alpas. Checkpoint 1062, mga balitang pumapagaspas. Sa checkpoint 1062, walang alpas. Tuwing Linggo, alas 7 ng gabi. Dito na sa Radyo Agila.
Tayo po nagbabalik dito na po sa Pinoy Scientist at pinag-usapan po natin kanina ang mga iba't ibang oportunidad na ng pagnenegosyo. So we're now talking about entrepreneurial pursuits in healthcare that that will push for the future of intelligent healthcare and human lifespan extension. So Paul, can you tell us about you being a serial entrepreneur? That's very an interesting aspect of your bio. What are the entrepreneurial pursuits and opportunities that you see in intelligent healthcare?
Thank you, Dr. Custer. It is a very interesting question. And I think, again, to be bold, that healthcare will change by entrepreneurs. And I would love to have more entrepreneurs in healthcare working who are getting the opportunity to change things. And healthcare is, per definition, a very change-resistant domain. They don't like change. Nobody likes change, but healthcare is the summit, I think. But let me break it down. Entrepreneurs are looking for opportunities. They see a challenge and think, well, what if? And then they are reasoning through what could be the result of a change. To give you a couple of examples. For instance, using VR, virtual reality, in educating people in rural areas. Everybody, not everybody, but many people do have a smartphone. There is reception in let's say in the majority of the country in the Philippines. A lot of people do have smartphones, and through those smartphones, you can educate people about their health, how to prevent certain diseases. What you can do with these kind of applications for smartphone, for instance, is if there's a breakout of a flu or whatever, that you now can follow the wave like a hurricane where it is moving. So that you see the trend where it is moving, so that you now can warn people who are vulnerable, who are in the line of that expansion of an epidemic. And then you can educate them how to prevent themselves from that, just as an example. Another example, you can use AI. For instance, and I'm mentoring a company, developed a 3D opportunity, a 3D image of your lungs, for instance. And in the lung, you have a tumor. But on a CT scan, you cannot see all the vessels and airways in the lung segment, in certain lung segments. So what they did is, based on a lot of scans, a lot of images, predicting where the veins where the bloodways and the airways of Dr. Custer in that particularly long segment most likely will be there. So what happens now if a surgeon is going to operate you, they can look through a 3D glasses to that image with the prediction, and you can roll up layer for layer in your lung to see what kind of airways or blood vessels are there to prevent them to be cut through. And that is leading you eventually to your tumor. And now they can see in that 3D how far they have to cut around to be safe that all the cells have been taken out. You can see that real time. Real time. And the next step, thinking as an entrepreneur, is, hey, maybe we can connect that to a surgical robot. So that now the surgical robot can do that automatically. And here is the rub. A lot of surgeons say, well, that's nice, Paul, that's really nice, but we see in our practice so many exemptions that a robot doesn't know. So in here, supervised learning kicks in. And the surgeon is teaching the robot that specific exemption. And now imagine that we have 1,000 or 10,000 of these robots around the world. And all those surgeons see different exceptions. So they teach the robot that procedure. And within a split second, all the robots around the world know that exception. You don't need to go to college and to study that exception. No, you know it immediately. So all the exceptions now can be included in the algorithms of those surgical robots. That is where it is moving towards. And that reaches us eventually to the question, do we need that many surgeons if we have these robots? And we know that those robots are getting smarter and smarter and better and better. That's just reasoning through a few years, and you arrive to the same conclusion. So that is how entrepreneurs think and work. But what you have to do as an entrepreneur as well is thinking in the possibilities, through the possibilities of where technology is moving and the speed of technology. And we are always underestimating the speed of, we overestimating, let me state it in this way, we overestimating the speed of change in the next 2 years. But we always underestimate it in the next 8. Because that is a way of thinking. We call that exponential reasoning. That means that things are doubling every time. But if it is 10x, then it is 10 times the doubling. And then we are already talking about billions. And that is how fast things are changing. An entrepreneur for instance, in the Philippines, that is what we proposed, is, well, get as many as possible well-educated, trained nurses from the Middle East to the Philippines and set up proper home health care. There is nothing there, or hardly anything. And if you do that, that immediately contributes to cost reductions in healthcare. Because those nurses are educating people can be discharged earlier to go home, and nurses will take care of you at home. They visit you, have an hour a day, do wound care or other things, administer medication, take a peek on you, do some measurements, and they take care of you. So that the burden on hospitals can decrease dramatically. And what it also does is that the nurse in the home healthcare situation can teach family partners to do also certain care for the patient in the right way. What we see around the world is that we outsourced healthcare to people that is their profession. And what we forgot is to take the responsibility ourselves, what we can do ourselves. And by doing that, we are making other people responsible for our health. To the extent that if people have cancer and the doctor tells them, hey, sorry, but you only have three more months to live, then people do that. Instead that they would say, well, if we do that, then you can stay alive. The mind of people work like that. And it is not in all cases, but it is so obvious that a doctor tells people you have 2 or 3 months to live, that people are dead after 3 months.
Yeah, that's a good point, Paul. The scenarios that you've been providing, some sort of like, a radical, shift, right, from conventional healthcare to preventive healthcare. But then you also want to have some sort of human connection, in this entire loop of, a future preventive healthcare system. Now, in the context of entrepreneurship, because in the Philippines it's pretty quiet, like the issue has always been the cost, access. And if you come to think about of it, it's really about, bringing the power back, right? Like to the people to take care and manage of their own health, which is the point of preventive healthcare. And when artificial intelligence, comes in, it also generates new type of public good and services, right? There are many services that will definitely be wiped out by the transition, to artificial intelligence, and that would eventually create new type of services as far as healthcare is concerned. Now, my question is really about social enterprise, right? And when it comes to the power of the patient or the individual to have ownership, right, of their health, is also the question about digital data ownership, right? So how does that play, like in the context of let's just say a national public health service or system, all right, wherein you have policies that define what a digital ownership looks like, and then what kind of opportunities would it create? Like, how can social enterprises participate in this, and not just companies and corporations?
Yeah, that's a very good question, and I think that patients, we see that in many countries, that patients somehow are creating patient associations. And those patient associations, and I am talking about many, then you have a voice. If you do that one-to-one, that doesn't work. You have to organize that and bring people together with a right message. This is what we are seeing. This is what we think can be improved, and let us help you. That it is not us to them, but together. And together you can make changes. And what always works very good, and that is again my entrepreneurial thinking, is working with experiments. That you start in a little, for instance in Manila, in a community where a hospital is, with that community, working together, collaborating, this and that is what we would like to change. How can we help each other to make that happen? And I bet you that within a few months, people come up with crazy good ideas that nobody was thinking about, and that is happening. But it is possible. And then you start with an implementation for that. That is how it works. So I'm a strong believer in experimentation. And experimentation does not mean that it is blindly doing experiments. but you have your hypothesis and you are testing those. And once you are once you are confirming a hypothesis, you are making a next step. And it can be on a very, very low cost. Instead of working through a thing that you think of, maybe that will help. And then when you are implementing it, it doesn't work. So the experimentation dynamics takes that whole thing out and do that step by step by step. But because you do that in a structured way, those steps can follow up each other really fast. And that is where I would start. Start small and expand big. Because now you have the data, because people believe in the data. And if you, in those experiments, in the implementation, collect the data, then you have something to talk about, right? And AI can help you with it. But it is all again in the data, and have you correct tangible hypothesis, not fluffy stuff. And start with things that are, I would say, the big changes. Once we have solved that challenge, then immediately the the doors are opening for many other horizontally, if you will, other challenges. It's very simple, but we have to start somewhere. So unite patients, connect them with the management of a hospital, and start with where can we change. And don't let you be discouraged by saying, oh, we are too busy. No, for this, you are never too busy, because it's in the end your life.
Well, we are up. We only have 5 more minutes left, but can you suggest policies that governments should consider to empower that idea of yours from transitioning from sick care to a truly healthcare system?
Prevention, prevention, prevention. And I think that based on, you have to do a scan of the population in the Philippines. What are the most common diseases? And start with that. So how can we prevent people from getting that illness, from getting that disease? Reason back to what the causes are and how you can prevent that. That is where I would start. And what the government also should do is screening programs. Screening programs, for instance, prostate cancer or breast cancer, colon cancer, can all be prevented by screening programs. And those screening programs are very cheap. If you do that in a right way, because the big amounts are counting here, and the sophistication again of the technology is helping us with that. It's not that difficult. People can even send some sputum to a lab that can be analyzed immediately. Very low costs. Sweat can be analyzed. Very low cost. And it gives you, those are indicators for certain diseases. But you have to start there. And the government, again here, can start with the province. Let's do this experiment in this province. And let us calculate what the cost savings are. And in the governments and every economy, the cost savings here, the decrease of costs in healthcare are key. And those are the triggers to make a next step.
And to scale it up. Sherman, do you have a final word before we end the show?
Yes, yes. This is a wonderful conversation. Really, like the future of healthcare is prevention, prevention, prevention. That should be the advocacy, right? In order for us to shift, to a much healthier future.
Yes, and
Absolutely.
I also captured some points where Paul talked about Filipino nurses. One of the important aspect of intelligence healthcare is not just AI intelligence, but it's going to be care and compassion, because in the future where there will be robots, artificial intelligence, digital twins, synthetic biology, I think compassion and human touch will play a very big role in making lives better and making health more accessible to everybody. So with that, we thank you, Paul, for guesting on our show.
Thank
It's
you.
really an honor to have an expert sharing thoughts for the Filipino people. And to our viewers, sa pagtatapos po ng ating talakayan, ang tunang layunin po ng intelligent healthcare ay hindi lang intelihensya at artificial intelligence, malasakit po. Muli, ako po si Dr. Castong, inyong kabarangay Pinoy Scientist. Kasama ko po si Professor Sherman na nagpapaalala ang hinaharap ng kalusugan ay nasa ating kamay at ito po ay may kasamang puso. Magkita-kita naman po tayo sa susunod na linggo dito po sa programa na kung saan ang siyensya ay buhay. Maraming salamat. Thank you very much, Paul. Thank you,
Best
Sherman.
pleasure.
Thank you.
Thank you.